today's World Insight, worries over a spike in confirmed COVID-19 cases in Hebei, the most in China since July. An all-out response to clamp down on the outbreak, but what's the long-term prognosis? And a likely geopolitical showdown of military muscle in 2021. How can China secure peace amid adversity? A defense studies dean with answers.
Playing games with military is very dangerous.
Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei in Beijing. We start with the COVID-19 situation on the mainland. The first death has been reported in 242 days in China. It took place in Hebei Province, a very first since May the 17th. Infection cases are increasing, facing the worst outbreak in China in months. Since the first reported cases on January the 2nd in Hebei Province, the total confirmed cases now has exceeded 400. Three cities within the province, Shijiazhuang, Xingtai, and Langfang, are on lockdown. Residents have been ordered to stay at home. Vehicle movements is restricted as well. The three cities have also an estimated population of over 21 million. Meanwhile, in the rural areas, there have also been rising concerns. Authorities are not taking any chances with thousands of residents evacuated on Monday from Hebei villages, where most of the cases were found. They said the second round of tests in Hebei, which began Tuesday, is expected to finish in 3 days, meaning later this week, while preparations are underway for mass vaccination. Meanwhile, the Chinese New Year, also known as the Spring Festival, usually gets hundreds of millions traveling across the country to their hometowns. But the passenger numbers may be more muted this year, as Chinese health authorities recommend travel during off-peak days of the festival or just stay put. Provinces started carrying out strict epidemic control measures to prevent outbreaks. For the latest development on COVID-19 worldwide, we are joined in Nanjing Wu Zhiwei, Director of the Center for Public Health Research at the Medical School of Nanjing University. In Beijing, Li Xiaoyun, High Chair Professor of China Agricultural University. In New Haven, Howard Foreman, Professor and Director at YSPH Healthcare Management Program, Yale School of Management. In Atlanta, Chen Zhuo, Associate Professor from the Department of Health and Management with the University of Georgia. Gentlemen, welcome to the program. So, Dr. Chen, we already heard the latest news is one death in Hebei Province. That's the very first time since May the 17th here on China's mainland. The very first death reported regarding COVID-19. Your take?
I'm sorry to hear about the new death associated with COVID-19 in Hebei. I think more information probably would be needed to assess the severity of the outbreak in Hebei. In general, I think the outbreak in Hebei, there is a strong measures has been taken to control the outbreak. I hope that things could get better before the Spring Festival. I think that's something that we definitely wanted to get control before there's a large mobility of the population.
So, Professor Wu, tell me more about your latest response regarding the first death since May the 17th in China related to COVID-19. It just took place in Hebei Province.
Well, actually, I'm not surprised with the first death because all the people and people with certain comorbidities are infected. So this is actually based on the past knowledge. There will be some people develop very serious consequences. But we have to be very careful that in the early intervention of those infected people, and then provide proper medical help.
What do you mean by proper medical health?
Well, actually, some people actually, such as the current therapeutic approach, which we have been using in the clinical to reduce the damage, and also people put on the ventilating system to help them breathe. I think all those are what I call the proper medical health.
What do you think are the reasons, looking from afar, Mr. Chen? A lot have been talking about the rural population, about the elderly population that's pretty much hit this time. Tell us more about your analysis.
I think for the rural area, there is a issue of imported cases from urban areas, and in general, I think China has been the cases in China has been under control, but imported cases always a concern. For rural areas, I think there's a lot of issue in terms of the healthcare service capacity, how the disease prevention centers could conduct the surveillance in rural areas. I think that's something that could be a challenge for the China's health system.
Mr. Li, a lot of these happening in the rural areas, and there has been a lot of discussions about that. What's your take?
Actually, the impression of previous pandemic very much concentrating in the urban area, that let people just forget that the rural area actually is the risk area. And because of three things we need to put into emphasis. First one, the rural physical setting is rather concentrated, particularly in the area like Shijiazhuang, plain areas. So it makes very easy for any infectious diseases to be spread, not only for the COVID-19. The second one is that rural people rely on very much a different form of social gatherings, and particularly for the elder people. And we see in Chinese tremor, neighborhood visit, and even where someone gets really sick, and the people coming to see them, to visit them. Last one is that these very weak public public health services. Those also makes those three factors makes very much complex of the rural area rather than in the urban area.
Professor Chen, we heard that there have been a large population of people being shipped away in buses, huge buses, from one county, for example, from the villages, rural areas, to some of the areas in which there can be proper care. Now, what does that say to you?
I think it indicates the determination and the ability to mobilize the population to control the pandemic. And meanwhile, I think there is a need to consider the pros and cons of this strategy. I think I'm sure that the local governments probably weighed the pros and cons and see if during the transportation, during the relocation, if there might be a chances that there's a further spread of the virus, and how to deal with the living arrangement of this population. I think that's going to be a challenge, and I think that's something the local governments will have to figure out.
Professor Wu, there has been enormous amount of population that has been quarantined in Hebei Province and in some of the other provinces just to prevent, as a result of being close contact or contacts of the close contacts. Do you think that strategy is working?
I think so, yes. This is actually one of the strategies which has been demonstrated to work in China. And we know that this is a very old, effective strategy in prevent the transmission of diseases. I think the thing is that, we have to basically come out with a more comprehensive approach, not only by quarantine, but also so-called contact tracing and also the comprehensive screening as well. So this is actually something which we have been doing for the past year, and we know it works. We know that it will pull down the virus from spreading to one area and one population.
Professor Li, knowing that you are an expert about China's rural areas and also poverty alleviation, Professor Li, tell us more. Can this practice be widely practiced, given the fact that now we are still talking about the sporadic outbreaks, but it seems that during the winter time, the challenge is going to be ever bigger?
If you look at the very large scale potential migration in coming weeks or in coming weeks that and we need first to take a very strict control imposed by the central government to actually strengthen the regional cooperation, because if without regional cooperation it will be very difficult. Just look one city, one province. So that is first. The second one, we also need to look at the lockdown within the village, rather than to move people to other places. So we need to look at the situation within the rural community, and that requires we need to understand the social habit and the social contact, all those things, and particularly to raise the social awareness, which is very weak, because over the last few months or even during the last year, and the people realize that is not the problem of rural area. It's the problem is very largely city, it's urban issue. It's not a rural issue. Now we need back to that awareness. We need to really improve our social awareness that the rural area is the risk area due to many conditions. Therefore, people realize that we need to change our social habit. We need to change our all kind of routine and the personal behavior. Those are areas we very much neglected since I've been working in the rural area over the last few months, and I realized in the rural areas nobody cares about this face coverings and the washing hand and all those measures. So we need to focus on this one to reduce the potential transmission and potential infection, rather than look for a large-scale problematic measure that will create a lot of social, political, social consequences.
I see. Professor Foreman, we see from the winter time things are getting ever more devastated. In the United States, of course, unfortunately, it is already topped the chart in terms of being infected and also the number of deaths worldwide. But Professor Foreman, given your analysis of the latest development, what can we say about this stage of COVID-19?
Look, I think the United States is unusual in the sense that there are parts of the United States that have practically ignored mitigation measures and have had vast spread, vast death, vast hospitalizations. There are other areas that have done a better job with it. But there's no question that the winter time, even in the warmer areas of the United States, has been a very, very deadly and dangerous time. The state of Arizona is a good example. It's a very warm state. The state of Florida is a very warm state, and we've still had massive outbreaks there. This has not been a good time, but I'm not sure the United States is a good place to measure mitigation measures, because I think we've done a very poor job of it.
If you look at the latest studies regarding the strains of the virus, that it is quite different in Hebei compared to that you have seen in the Shunyi County of Beijing. And it's also different from what is going on in northeastern part of China, according to the latest studies. So it seems that it's not the same kinds of strain, and yet different strains developed in different areas. What's your analysis of this situation?
The United States has been a laggard at genotyping. The United Kingdom has probably been at the top of the heap in terms of genotyping. What we're learning right now is that it matters to genotype, and that we should be able to figure out which strains and variants are out there, and to learn as much as we can about each one. What we know right now is that some of the new variants that seem to be emerging are more infectious. They do not appear to be more virulent, meaning they do not appear to be more harmful. But as your other guest has said, it's very important that we start to get on top of this, because it may be our path to figuring out better therapies and protecting the populations better. At the moment, if it is more infectious, that has very dire consequences, because it means that it will spread much more quickly through the population, leading to a much higher burden of disease and ultimately more death, even if the virus itself is not more lethal.
Professor Chen, now there are a lot of questions that have not been solved. as we look at the cases in Hebei and also in northeastern part of China, from a health management perspective, what do you think are some of the most crucial issues that need to look into?
I think the key lesson is to plan ahead, to have a good plan that in these type of emergency situations.
Well, I think we have a plan, don't we, Professor Wu?
Yes, we do. But I think, another thing which I would, suggest to implement is that for those high risk population or the people who may have a high exposure rate, actually, we should conduct so-called periodical nucleic acid test. So that actually increase the chance to identify the infected people at the early stage. Or we found that in this new surge is that those people actually do get infected, but we didn't know. And once they actually develop symptoms, sometimes it's too late because they got multiple contact with other people and people travel to different parts of the country. So that actually complicated the entire issue of the disease control. So I would suggest to do a periodical screening.
Professor Foreman, do you think that would be a good strategy?
Look, I think that every location has struggled with different types of strategies. I think that the best strategy right now is a local one that looks to contain your region, that takes account of the people in your region and how much you can lock them down for a couple of weeks and get through this very dangerous period of time.
Here comes the complicated issue about policy, Professor Li. The Spring Festival, in other words, the Lunar Chinese New Year is approaching. It's a time for family reunion, just like Christmas, Thanksgiving in the Western culture. Now, people would love to travel back to their hometown. Is it possible to change that practice for this year, given the pandemic? Professor?
I don't think it is easy to change people's behavior. This is very social. It's deeply rooted in our society. So it is unrealistic just to say, don't do it. But I would say the first what the government has been doing rightly to say, well, reduce it and try to spend your festival with your relatives, your friends in the area where you're working and reduce travel. And secondly, to completely stop, but advise people to control by themselves. And I always try to emphasize that self-control and self-awareness and change individual behavior is the fundamental in a society to prevent a large-scale transmission.
But Professor Wu, that exactly seems to be why some of the countries have failed, isn't it? To depend on self-awareness, self-responsibility, and citizen responsibility. People are not necessarily following all the advice, and therefore it got problematic, as we see over the 1 year. Professor Wu.
Yeah, Tingwei, I agree. If you look at the Western Europe and look at the Americans, so basically that's the problem. I mean, with the pandemic actually running around the country, you can't purely just rely on individual behavior and their own consciousness. Usually it doesn't work. And I would suggest authorities should do something like in more constructive ways, such as we could have a differential starting date of the holiday seasons instead of starting the date all the same in the country and the people are basically packing into train stations, airports, and going home. And in that kind of a situation, it's almost impossible to keep a social distancing and to avoid the cross. Then you will see a large transmission pattern will eventually come out. So I think there are multiple ways we could reduce the people actually on the way back home and gathering with families. Once they are in their families, then you can avoid that they would have dinner parties and gatherings with same friends and relatives. So this is something actually we really need to bear in mind in this particular time.
Professor Foreman, I would love to have you jump into this conversation. I mean, about relying on citizens' social responsibility, their self-awareness, and does it work?
Look, I think that it varies considerably. There are parts of the United States where you have homogeneous communities where people are both self-reliant, but also respectful of one another. And I think that helps. I think when you have people that have obstinacy or anger at government and want to flaunt, their independence or flout the rules, it doesn't work. And so I think that, look, in America, we look with admiration at some of the heavier-handed abilities of many countries throughout the world to have contained this, at the same time that we understand that very much of what makes us a libertarian country has contributed to our excessive death rate.
Okay, Professor Lee, you want to add anything?
I would like to emphasize that we cannot only rely on the social awareness and personal responsibility. We need a comprehensive measure. We need a very strong government. We need an excellent public service system. We should not neglect, and we need personal responsibility as a citizenship.
Yeah. Another question is about prevention and control. It is about not only international travel, in fact, but also travel within the country in which there are pandemic flare-up in some of the communities. Now, Professor Foreman, we see Japan, for example, with the sharp rise of numbers, it is already decided to close all its national border. We see that also in other countries. We also see limits of travel with many countries as well. What do you make of these measures?
A year ago, I think we had a lot more uncertainty about these measures because we, number one, didn't know whether they worked, and number two, we didn't know what we would do even after they worked. So here we are almost a year later, and what we saw was that as bad as Sweden had it, that by having effectively closed borders and by effectively social distancing measures and not even very aggressive social distancing measures, they got their outbreak down to almost nothing over the summer months. So we know that the spring and summer months are going to be our friend in most locations. Yeah. So if we can get over the hump of these few months right now, we can do a lot of good. We know that we have a vaccine coming on board right now, and in some locations, vaccination is occurring at such an aggressive pace that we pretty much could get to the end of summer and have large parts of the population, and certainly the most vulnerable individuals, vaccinated. So that gives me hope that aggressive measures right now are probably going to pay off in a big way in terms of saving lives and maintaining an underburdened healthcare system.
Let's talk about some of these measures. In China, for example, Professor Wu, there's something earlier of 14-day quarantine, which has been a practice adopted later by many countries around the world. Now, with some of the latest cases suggesting that 14 days is not enough, there is something called a 14 plus 7 days, meaning 14 days of enforced quarantine plus 7 days stay-at-home voluntary quarantine. Professor Wu, tell us more about the latest practice. How much hope are we pinning on this for success?
We're definitely, pinning certain hope on this by extending the quarantine period. Initially, we thought that 14 days would be enough, but as we learn more and more about this virus, we realize that actually it's probably not enough for some infections because in the clinic we do find that people have incubation period longer than 14 days. So that actually is a big challenge. I mean, frankly, we don't know whether 14 plus 7 is sufficient for all the cases, and we may be surprised later on that 14 plus 7 is not even enough. So this is something actually we are keep learning in terms of how the virus actually gets spread across the world.
Professor Wu, on the other hand, we also see practices similar going on within the country. For example, those coming from the so-called the middle and the higher danger area of COVID-19, when they're traveling to the other parts of the country, they will also face 14 days quarantine or even more measures. There's always a degree of measures. So what do you make of the latest practices that is going on in this country?
Well, actually, definitely I see certain kind of overreactions, and I would call it panic reactions when you identify, a small country with a couple million people there and a few dozens of cases, and then basically that touches the nerves of all the surrounding areas. People tend to overreact, saying, okay, this is just something we need to take some drastic steps to curb the virus spreading. But we have to be really careful with this kind of approach, because people's livelihood and the businesses and all sorts of activities will be affected. I think from public health point of view, we could have a more a productive approach. So this is something actually I would call it the cost and the benefit. We have to find a balance. Not take a over drastic step in curbing this virus.
Yeah, this is always a very fine balance to tip, isn't it, Mr. Chen?
Yes, it is. Yeah. I think one way that we probably can get out of this and restart the economy probably is, restart the international travel probably is to offer to some extent the recognition of the vaccination certificates. At some point, we will have to vaccinate a large percentage of the population, and how China can recognize the vaccination in the United States and the US can recognize the vaccination in China, I think that's something we need to think ahead.
But it's still quite far from where we are facing right now, isn't it, Professor Foreman?
Look, I think the biggest thing that we have to remind people about is that we have a vaccine that is highly effective. We have at least 4 such vaccines right now. We'll probably have several more over the next few months. And it gives people much more urgency to mitigate spread and prevent deaths now than when we had all the uncertainty of a year ago without knowing that we had light at the end of the tunnel. That to me is the biggest motivation I can offer anybody to listen to either an aggressive governmental approach or even taking more personal responsibility.
Professor Li, what is your take about what we are facing right now and the measures?
I think that it seems that in some areas we do have some overreaction on that, and at the same time we need to realize that, as all the panelists mentioned, that we need to put first very strict measures to prevent the infection, to reduce the baseline, to reduce the size of baseline. Otherwise, it will be very difficult for the future. At the same time, we need to really put into a different ways to reduce the social pressure, and even we need to put, as a social scientist myself, we need really pay attention to the social discrimination with people when people travel, and we see that kind of a situation, that discrimination issues. We need to put into a social atmosphere that we need to realize the importance of social surveillance, rather than only look for the public health facility. And we need also looking for social solidarity and other issues which can reduce significantly the social disorder and other issues, which gives us social base for what government has been calling for, and also for the solidarity of the community and all other issues.
Thank you so much, Howard Foreman, Wu Zhiwei, Li Xiaoyuan, and Chen Zhuo. Really appreciate it, and be safe, gentlemen. Thank you for joining us.